Dear students, welcome to the fourth online lecture of clinical pharmacy. This is your course lecturer, Yasser Abbasi. In previous lecture we studied different types of guidelines. You must have noticed in previous lecture that evidence-based information is required to construct clinical practice guidelines. We discussed the evidence in detail and we also studied the practice of finding answers to a clinical question followed by implementation of these answers and then follow-up to examine the implementation of an evidence-based approach. A lot of information is screened and scrutinized to find the answers for questions related to clinical practice including pharmacotherapeutic questions. Therefore, in preceding lectures we will study literature evaluation. Before we actually move to literature evaluation, let's first take an overview of different types of studies and level of evidences that these studies provide. Pharmacists are relied upon to answer drug information requests for patients and healthcare professionals. In addition, the pharmacist is expected to provide the response in an efficient and timely manner. Therefore, the ability to systematically process the request and efficiently search the literature is necessary to provide an appropriate response. Different types of literature sources supply information needed to answer the drug information request. These sources include tertiary, secondary, and primary literatures. However, the request should be clarified and classified before the search can be initiated. The classification of the request, for example, adverse drug reaction, drug interaction, drug therapy, will guide the user to specific resources. Primary literature means original works, secondary literature refers to indexing and abstracting services. Tertiary literature means textbooks and review articles. The initial step in searching for the answer to a drug information request is to access the tertiary literature. This type of literature serves as a resource of established knowledge that provides an overview of topics published within the primary literature. The information contained in the tertiary sources can change based upon new information or knowledge documented in the primary literature. Different formats for presenting this type of literature are available and consist of textbooks, for example, Pharmacotherapy, a pathophysiologic approach, Drug Information Handbook, Rogers Clinical Pharmacy. Compendia are also exampling of tertiary literature. For example, American Hospital Formulary Service, and full-text databases, for example, Micromedex. Also considered tertiary sources are review articles that summarize a topic and may contain more current information than textbooks, for example, atopic dermatitis, update on pathogenesis and therapy. A database is an organized collection of data, generally stored and accessed electronically from a computer system. In case of pharmacy or biomedical fields, the databases index all the available sources on topics of pharmacy, medical, and biomedical. Before we see characteristics of tertiary literature, we would see some examples first. Assume that you are requested for information on therapy of atopic dermatitis. Here is an example of tertiary literature. You have 8th edition of Pharmacotherapy, a pathophysiologic approach. You find that there is a chapter titled Atopic Dermatitis under section 14. You can now find the information about both pharmacological and non-pharmacological therapy for atopic dermatitis. And you can answer the queries of doctor confidently as you have consulted an authentic source of information. However, can you claim that all of the information given here is up to date? although the information is authentic, and it is not easy to challenge this information. What do you think? Is this information completely reliable? If you check the publication year of this book, you would find that this edition of book was published in 2011. It lacks the information about atopic dermatitis that has been generated after 2011. The basic information and well-established facts about therapy of atopic dermatitis remains same, but you would not get updated information. As for today's date, there is approximately 9 years of gap in information. Similarly, the 9th edition, published in 2014, contains updated information as compared to 8th edition. The knowledge gap between 10th edition is approximately 3 years, as it was published in 2017. The most updated edition would be the 11th upcoming edition. Have you noticed the gap of publication years between each edition? Every 3 years a new edition arrives in market. Now suppose we are living in 2022, will we consider the 11th edition as updated? Of course, not. However, please remember that the basic concepts and established facts remain same. Therefore, as far as our studies of graduate level are concerned, we can refer to 10th edition without any hesitations. Please recall that this was an example of tertiary literature. Another example of tertiary literature is Drug Information Handbook or Pharm Guide. These are the books that you are supposed to carry with you during your clinical clerkships. These drug information handbooks are a reliable source for fast, accurate and quick essential prescribing and trade information on all medicines with their therapeutic categories, contents, indications, dosage, contraindications, precautions, interactions, adverse effects and prices. These are updated every year. In our example of atopic dermatitis, you can explore therapeutic categories and then find information for its therapy. Remember that this is a quick way to find information, and you would see concise information only mostly in bulleted form. If you would need detailed description of therapy of atopic dermatitis, you have to refer a textbook or other source. You might not find logical answers from Pharm guides. Please recall again, this was an example of tertiary literature. Another example of tertiary literature is online databases of drug information. For example, Micromedex is an evidence-based, multi-database drug search engine that provides summary and in-depth information for drugs, both prescription and over-the-counter commercial products, diseases, toxicology, and alternative medicine. It also provides patient counseling tools for medications, procedures, and conditions. It can be considered that such databases are digital form of Pharm guides. And these databases are comparatively easy to explore and update as compared to Pharm guides. The new information is updated on spot instead of waiting for some time to publish new editions, like in case of Pharm guides. However, these databases are classified as tertiary literature because the information that is included in these databases comes from primary literatures. Please note that these types of databases require subscription. In our socio-economic conditions, these are usually not affordable. There are many other examples of tertiary literatures. The tables in these slides provide an overview of such sources. You can also see different classes of textbooks. These are for your reference only and you are not required to memorize them. However, a basic understanding is required. For example, if you are asked about the type of literature with reference to Martindale, the extra pharmacopoeia, you should be able to tell that this belongs to tertiary type of literature. In next slides we will further discuss the types of textbooks. The next example of tertiary literature is review articles. One free database for searching research articles is Medline. Now in our example of atopic dermatitis we are looking for therapy of this disease. Note that I have used search terms for atopic dermatitis therapy and I have got 578 results after filtering the results for review article and free available articles. If I was looking for atopic dermatitis therapy with reference to a given drug, I could use it in search terms. Or if we were looking for atopic dermatitis therapy in particular age population, we could use terms like adults, pediatrics, geriatrics, etc. Now let's say based on our desired population we have selected this article to study. This article is recently published and expected to provide information on most recent researches available in this category. When you start reading this article, you can find that in addition to basic treatment, the updated information about various other treatment and new drugs is also given. Note that you might not find updated information about new drugs of atopic dermatitis in textbooks. Can you repeat given steps in finding a review article? This will work as an introduction to Medline if you have never tried this before. Now that we have seen all examples of tertiary literature, let's discuss their characteristics. Tertiary references provide the user with easily accessible information presented in a concise, logical format. Thus, the user is presented with a manageable document that is prepared from a vast amount of published information. Several different classifications of textbooks are available as we have seen in tables given in previous slides. These classification assists the user in performing an efficient and timely search. For example, if a healthcare professional requests information concerning drug interactions with aspirin, the user can locate this information easily in certain resources, that is, textbooks, which is opposed to searching the entire collection of tertiary literature. Although tertiary literature is convenient and readily accessible, several limitations exist that the user should consider. The lag period between the time a resource is written until publication may be a few years, therefore, the information may be outdated before publication. New editions usually are published every 3 to 4 years. In addition, space limitations within the text may prevent the preparation of an extensive topic discussion. Also, the authors may emphasize a selected topic or prepare a biased report in favor of the author's beliefs. Furthermore, the authors may not have accurately and comprehensively searched, analyzed, or interpreted the information and the document may be misleading and/or inaccurate. Due to limitations within the tertiary resources, a single source may not contain all of the necessary information to complete an effective search, therefore, at least 2 resources should be searched. The user should evaluate tertiary literature sources as critically as the primary literature, for example, clinical trials. The selected resources should contain the most current and relevant information addressing the topic. Choosing a source that is updated, monthly, quarterly, should aid the user in finding the most current information. Also, the credentials of the authors and contributors can influence the quality of the reference. The information provided within these resources is evaluated and interpreted, therefore, the possibility of human error should be considered. Furthermore, the presence and quality, that is, original works or tertiary literature, of reference citations within the text allows the user to evaluate the origins of the information. The scope of the healthcare services provided by each institution should be considered to determine the collection of core references. Each institution varies in the services offered and the financial resources available to purchase the publications. For these reasons, healthcare providers should select applicable references to be used in their daily practice. Review articles, sometimes called literature reviews or secondary sources, synthesize or analyze research already conducted in primary sources. They generally summarize the current state of research on a given topic. A review article or review paper is based on other published articles. It does not report original research. Review articles generally summarize the existing literature on a topic in an attempt to explain the current state of understanding on the topic. Review articles can be of three kinds, which we will study in detail in next lectures. Review articles have the same inherent limitations as the textbooks. For this reason, an approach is needed that limits bias and provides the user with a comprehensive overview of a topic. One such technique is systematic review. What is systematic review? We will discuss this in next lectures. In summary, tertiary literature provides the information needed to begin an efficient search. This type of literature is useful for a quick and concise reference. However, due to the limitations of the tertiary literature, other references are needed, for example, secondary and primary literature, to develop a comprehensive, accurate answer to the drug information request. We will study secondary and primary literature in next lectures. This is the end of this lecture. The soft copies of these slides are available on HULMS. You can reach me on given email. Thank you. You can now close this video.